Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Lawrence Gostin, a Georgetown University professor and public health expert. They discuss the ethical obligations that the United States has to the rest of the world in helping to end the COVID-19 pandemic by providing vaccines globally to those who don't have them. Let's listen.
Larry Gostin, thanks so much for joining me.
Pleasure to be here. Thanks for having me.
So today I wanted to have you on to talk about vaccines, COVID vaccines, but I really want to talk to you about what they mean in the global sense. And I know we've seen a pretty chaotic rollout here in the United States in terms of a huge demand right now, which is outstripping supply for the moment. But I want to talk about really what our ethical duty is to the rest of the world. So I wonder if you could talk to me a little bit about where we are globally and why it matters so much what's going on elsewhere.
Yeah, I believe that the United States and other rich countries have an ethical duty, a very high ethical duty, to ensure equitable distribution of the vaccine worldwide. But I think it's not just the morally right thing to do, but I actually think it's in our national interests to do it. But we don't quite see why, as a matter of ethics or our own self-interest, that it is. So let's just start with a very simple fact. Every human being has equal worth. It doesn't matter whether you were born and live in the United States or Brazil or Guatemala or India or South Africa. You have the same dreams and aspirations for a good life as anyone else. And your country has the same claim to prosperity and to have their economy running. American exceptionalism should mean that the United States has a moral duty to others. We're exceptional because we care about the world. We're not exceptional because we're greedy. And that's what we're doing now. We're hoarding vaccines. The United States and a few other high-income countries, the UK, Canada, the European Union, have bought up the world's vast supplies of vaccines. And so it's very possible, in fact, it's probable, in the United States, by the end of the year, we'll have most of us vaccinated. That may not happen in lower income countries for 2 years, 3 years, 4 years. And so this is just, in my mind, unconscionable. And I can talk about why it's in our self-interest as well, if that's helpful.
Please do.
Sure. Okay. So, one of the things we hear all the time is we have to vaccinate America to prevent the mutations and new variants, and that we're a race against time. And even my fellow public health experts are saying that. I bristle at that. I actually think that it's absolutely wrong, because what we know and what we've seen is that mutations arise if the virus is spreading wildly, no matter where they are. It's not just in the United States. Remember, all of the variants of concern originated elsewhere. The UK variant, the Brazil variant, the South Africa variant. And so why would we think that if our population is vaccinated, but the rest of the world isn't, that new variants wouldn't reseed themselves in the United States, cause clusters of cases, perhaps with more serious disease, more transmissibility, and even resistance to the vaccine? So vaccinating the world is in America's self-interest. No one's safe unless everyone's safe.
So what can we do to fix this?
There are a lot of things we can do. For a start, the minimum start we can join the World Health Organization's COVAX. It's the facility for equitable distribution of COVID vaccines around the world. The United States is an outlier. All the major countries in the world have joined, and the only two major ones that haven't is the United States and Russia. Even China has joined. All of our allies have joined. Joe Biden said he's going to, and I'm sure we will very, very soon. But we need to amply fund COVAX. And here's the proposal that I would like the Biden administration to consider. I understand that our primary duty is to our own population, and that it would politically be suicide for the Biden administration to ignore our own population. But what if we used our vaccines to vaccinate all of our vulnerable people? So the elderly, pre-existing conditions, health workers, essential workers. And after that, donated our vaccines to COVAX and to lower income countries so they could vaccinate their high-risk populations. And then by the time the year is up, there'll be much more supply and we'll be able to continue vaccinating our entire population. That seems to me it's looking out for American interests, but it's also the ethical and right thing to do for the world.
So I know that other countries have developed vaccines. I'm thinking particularly of Russia and China have developed their own vaccines.
Yeah.
Can we trust those vaccines scientifically?
It's a good question. I guess the answer is yes and no. The no part is that we have not seen phase 3 clinical trial results from either the Chinese vaccines or the Russian Sputnik vaccine. And so I think that it's a major concern. There's been no transparency, and it's a deep affront to science to deploy a vaccine before we know it's safe and effective. Having said all that, already the Sputnik vaccine and the Chinese vaccines have been used very widely within China and Russia and also globally. And so far, they've seemed to be somewhat safe and somewhat effective, not as effective as the messenger RNA vaccines like Pfizer and Moderna, but still effective. And of course, we have another set of vaccines coming up, the Johnson & Johnson vaccine, which the FDA might give authorization for very, very soon. And then there's the AstraZeneca vaccine from the University of Oxford that's been approved in the UK, the EU, and is being widely deployed throughout the world, principally using India as an engine of vaccination.
Is there concern that the vaccines are being deployed other places in the world that may not be as good as the ones that we're holding on to?
Yeah, I mean, right now we're all chasing after scarce vaccines. One day, we'll be thinking, well, which are the best vaccines, under what circumstances, for what risk groups? These are hard questions because the truth is that the Pfizer particularly and the Moderna vaccines are very, very hard to deploy globally. Why? They're effective, they're safe, but Pfizer requires deep cold storage, and Moderna also less so, but also cold storage. And these are difficult in lower income countries, rural areas, and things like that. There are also 2-dose vaccines. Johnson & Johnson is a 1-dose vaccine. It doesn't need those kinds of high freezing conditions for the supply chain. And the AstraZeneca vaccine is a 2-dose vaccine, but it's also much more affordable and also much more easily stored and delivered. So we're likely to see a two worlds, one with probably less effective vaccines coming much, much later. And then the first world, which will get the best vaccines and will get it very, very soon. In fact, we're getting it now. So Emmanuel Macron of France called it a 2-speed world. South Africa called it a vaccine apartheid. And Dr. Tedros at the World Health Organization said that it's a moral failure of catastrophic proportions. And I agree with all three of them.
Will vaccines end this pandemic?
Well, it depends what you mean by end. We're going to be in a much, much better place in the United States, the European Union, and other higher income countries by the end of this year. But it won't end. We'll still have cases. Clusters of cases will recede from other parts of the world. And we're going to need boosters because the vaccines will only last so long, and they may become less effective against certain variants, like the South African variant. And so I can foresee COVID-19 becoming endemic. Most of us do believe that. So for the foreseeable future, no, we won't end it. And we'll never eradicate COVID-19. We've actually only eradicated one major disease, which is smallpox. But that disease doesn't have an animal reservoir, whereas COVID-19 does. So we're not going to eradicate it, but we may, like measles, eliminate it from certain parts of the world for periods of time. By elimination, we get it to very, very low levels, but not completely gone. And that's probably likely what we're going to see in the US. Yearly vaccines like the flu continuing to live with SARS-CoV-2, but doing a much better job of it and getting back to normal within a year or two.
If we aren't giving enough vaccine to low and middle income countries, will they see the end of COVID or will they not?
They will not. Certainly not till there's herd immunity in their populations. And so, we're going to have the really unconscionable specter, which is very likely, highly likely, of the United States, the European Union, and others, going back to relatively normal, our economies humming, being happy, going to restaurants, and people in Latin America, Africa, the Middle East will be continuing to suffer, to die, and to have stagnating economies. And so as a result of that stagnation, people will starve. You're going to have problems with the health system. And I don't think low-income countries are going to soon forget about the fact that we hoarded life-saving vaccines. It's going to make for a lot of political instability, a lot of bad faith, a lot of hard diplomacy going forward. It's in everyone's interest to think about equity and fairness. We talk about fairness and equity in the United States. Let's do it. Let's lead the world in an equitable distribution of the COVID vaccine so that all can benefit.
Is it too late or is there time to fix this?
There's time to fix it, but the time is running out. But there's absolutely time to fix it. We're right in the beginning of our vaccination campaigns. We could easily really turn our attention to ramping up supplies and to providing technical advice and resources for health system vaccine delivery in lower income countries. It would be the right thing to do, but it's also the smart thing to do.
And the hard thing to do.
It's the hard thing to do politically, but it's not a hard thing to do morally, socially, and economically.
Absolutely. Larry Gostin, thank you so much for joining me.
It's a pleasure to be with you. Thanks for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.